rolling scars. Okay?
Pig scars.
Who?
Pig scars also.
Pig scars. Okay, we call them
Then,
ice pick scars.
that's
And what Channing mentioned just before she ran out and said, speak slowly, of box scars. And so that's what they are looking like when you take a look at the cross-section. And these are the most common types of acne scars. And there are rarely some other scars available. Might anybody think about a different type of scar that comes and goes with acne?
keloid.
Yes.
Someone's doing her homework.
Somebody knows his stuff here.
And
What
just
Looking at
keloid.
those videos.
Okay, and then just before a keloid happens, there are some people who get something that is called a hypertrophic scar, right? And every once in a while we see that with acne scarring as well. But these two, hypertrophic scars and keloids, are much more rare in acne scarring. The most common features are any of those, rolling scars not quite as often. So how do we consult our patients who are coming in for acne scars? Well, obviously we need to take a good look and we need to understand what are these ice pick scars, what are box scars, and what are rolling scars. And all rolling scars are is a bunch of box scars all next to each other, and they were able to kind of push the skin in all these valleys and hills, and it looks uneven when you look from any direction. So if we understand what these scars are, we can now think a little bit of what we want to do for treatment. How we can counsel our patients in the most effective way. Because they may be saying, okay, I have these deep ice pick scars, I need them to be gone. And you're going to say, I have absolutely zero technology for you because you have the darkest skin ever and that technology has not been invented. You just need to know that because you have to understand how we can repair. So we're going to start now with ice pick scars. These ice pick scars, as you see, they have this kind of nice little shape. They almost remind you of really, really big pores on the surface of the skin. And if you are somehow able to glue these walls nicely together, you create this. And you don't see the scar here anymore. How cool is that? And how do we do that? With one technique, and that is called TCA cross. And this is 80% of TCA that goes in here, creates enormous inflammation, and pulls the skin together. And it works almost 100% of the time. I should never say 100%, but the outcome of repair of ice pick scars is extremely rewarding, but it's also very challenging because if used in the wrong location, this scar will never contract. So if you have skin that's nicely suspended over the bone or over cartilage, like for example you have ice pick scars up here on the dorsal nose, the skin is totally suspended, it will never contract. And you may potentially end up with a bigger scar. And so you need to be able to counsel again, not only what scar it is, but also where they are located. The forehead is not an area where I easily say, oh, you get great results. I always will say, I'm not sure that I can do an amazing job on your forehead. We can try a little bit. I want to be much more careful. I'm not going to be using 80% of glycolic TCA. I'm going to be using only 35%. But I'm going to try, but I can't promise. But on the cheeks, you get
What do you need?
great results.
Yeah, we only
At
have
2
one.
o'clock?
At 2 o'clock. So we'll be.
Is it 2 o'clock already?
No.
Okay, so if you could have her have a seat for a second.
Okay.
And or somebody can start a tour. Okay, for quarter off. So know where those scars are, know where it can make a difference, and then counsel accordingly. And here in our office, I'm very anal about that. I would like to be the one, if I worsen any scar, it should be me. So I would like to take the responsibility of this TCA cross technique because this is definitely really, 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 really it's sensitive. You really don't want that responsibility on your shoulder. It's just too much hand holding, too much everything. If somebody is skin type 1, 2, 3, very straightforward, you don't need to say anything. If somebody is skin type 4, you're going to say, you're going to have amazing results, but you're going to terribly hyperpigment. Would you like to still go ahead and do that? And they're going to say, I'll cover with makeup, don't worry. When will the hyperpigmentation go away? And then you're going to say, okay, well, maybe if we pre-treat with a little bit of fading cream for a month before, and then do a little bit more fading cream the months after, we can hopefully minimize it to just about 1 month, and then maybe you really don't need to use the makeup so much anymore. But you always need to counsel them that they might have pigmentary changes that require hand holding and additional procedure. And if there's somebody who cannot tolerate fading creams, I counsel them, you will need pulsed dye laser treatments afterwards. And I will not provide them free of charge if I have counseled them on that. I will only provide them free of charge if I fell into the trap and I forgot to ask my patient about the specifics of their heritage. But if there's anybody Mediterranean in there, then I know already I will say it. So skin type 4, really, really very sensitive to TCA cross, will always hyperpigment and will require probably some makeup coverage before it looks, even without makeup looks great. But they're all ecstatic after the results. They're going to say, I put makeup on and I have no more holes. How great is that, right? So they're all comfortable with the results. Now your skin type 5 and 6, what do you do with them in ice pick scars? You're going to say, I have nothing. But if you absolutely, absolutely, absolutely want to work on something, we can try to do a little bit. And when we do a little bit, meaning with the TCA, you have a 3+ result. That's sort of like the highest you can get. I'm going to call it 3+, my maximum results that you can get. Now, I already said it's close to 100%. But I'm going to give a 1, 2, maybe 2+ to PicoSure. PicoSure is first of all safe on any type of skin. And a number of treatments, maybe 4 or 5, can help in ice pick scars. But you need to set the expectation. It's not like here, a single treatment will do the knockout. It is, you're promoting more elastin, you're pushing basically from the outside. You're pushing your elastin and collagen to push the scars together. It's not as great as a result, ultimately, but if you want to do something on this darker skin, you're limited to that.
Are you talking about PicoSure what? Array or?
Any. Focus lens or regular. I have not found a difference. The company says focus lens works really well in acne scars, but they don't say what acne scars it works well in. But what most of the studies refer to is these atrophic box scars. But nonetheless, it can make a little bit of difference with the PicoSure or the Picogenesis in Center City. Again, number of treatments. I don't know that I would say 4 is a good number. Maybe more.
I don't even give numbers anymore.
No, it's good. Don't give numbers. It's a bad idea with acne scar treatment to give any numbers. I usually say it's an ongoing process. You're going to be in it for a little while. This is the current technology that we have. We have the state-of-the-art technology here. There's nothing better than what we have in our offices out on the market. If something better comes along, 3 years down the road, 10 years down the road, you're probably going to go for another treatment and another one once you've maxed out on what you can achieve with current technology. This is how I phrase it. I don't say your scars are going to be repaired in 3 months. Never. That's not something that we have available because we cannot yet induce the collagen that makes scars undone. Okay, talking about box scars. What is the best treatment?
Infinity.
Yes. Okay. Infinity. Now, what other treatments are out there to treat box scars? Fraxel?
Or fractionated lasers.
Okay, so we're putting here fractionated what? Non-ablative?
Yes.
Okay, and then probably before that,
CO2.
yes, which is fractionated ablative, right? Okay, so these treatments work well. Infinity, at this point of time, by far the best treatment for acne box scars. By far the best. Why is that? Because with the fractionated ablative treatments, we're destroying too much of the epidermis at a given time. Maybe if we did one and then many Infinity treatments, that would work. But I don't think it's really necessary many times to do anything that's even the slightest bit ablative, because if we're doing this one too much, we can also cause scars. I just want to warn you, a CO2 laser can cause scarring. It only repairs scars. It can, when it's used too frequently, too much pulse stacking at the same time, it can definitely cause scarring. So fractionated non-ablative, our 1540, excellent technology, also has relatively little downtime, but you see it is the third on the list here. It's not the second on the list and not the first on the list. But if somebody can absolutely not have downtime and has atrophic scars, the 1540 XF is a good option. Other things that we do for box scars.
Do you not ever do the Pico for box cars? Is that just not?
Okay. Down here, I'm going to give it number 5
Number 5.
and leave number 4 open. I'm going to say Pico. Now, it's not a bad treatment for atrophic scars if you pair it with something else.
Okay.
So if you pair it with, let's say, you do Pico and fractionated non-ablative, if you do Pico and Infini, you get much more of that collagen production at once, and you can space those in between and at shorter intervals. So if somebody's really in a rush to do something more to their scars, you can pack the Pico in. It is producing collagen and elastin. It's remodeling a scar through stretching. And those box scars are looking like that because they're pulled down. And so the acoustic wave of the Pico kind of loosens that up. And so they flatten out and soften a little bit right over here. Okay?
Soften.
So this is what happens with PicoSure technology.
And you don't, there's no need for the XD for,
Okay, if you have somebody with hypertrophic scars and acne, your 1540 XD is an excellent choice. And we see that with all other hypertrophic scars as well. If we're using the XD portion, and then only at a later step when we have really everything nicely flat, you can go over maybe with one more pass of the XF, but the workhorse for anything that's thicker is your XD.
so not deeper necessarily, thicker that I see.
If you need to kind of go a little bit more into the tissue, into the depths, the scar doesn't need to be deeper, that means there's atrophy. You want to, can there be a scenario where the XD is also helpful? Could be, but I cannot think about it right now. Maybe in context of a patient I could see that. Okay? All right, so I don't know what number 4 is here. I'm just going to leave it open just so that you don't, you're not under the impression that Pico by itself is a great treatment for atrophic scars. I don't find it to be a great treatment. I think it's a great adjunct. Okay, rolling scars. Anyone?
We do them all with a surfacing laser, like a pixel or something fractionated.
Okay, all right. So very, very good point. So here you want to kind of really do something to flatten this out. And you can do it in a number of different ways. You can think, well, maybe if I can really undo the adhesions here, and we call this process subcision. And subcision is a technique. I don't know if any one of you have watched me. I think maybe you have. No?
I didn't do a subcision.
So basically I go in underneath the skin with a very large bore needle and I free up these adhesions that pull this down with the needle that rasps back and forth until I free all of those up, and what happens then, it looks like this. Right? So I'm kind of above this median line, and then it becomes a little easier to treat this area here because those adhesions, they have sprung up, right? And they're not as far pulled down. This is a technique, again, I would prefer not to have to put on any of your shoulders because it's invasive. We have to do it with numbing medicine, not just topically applied injection numbing medicine. There's a risk of infection doing that because we create a dead space underneath here, and bacteria that normally live on the skin can invade in here and can cause infection. The risk of infection is low, but it's not trivial, and every once in a while I have to treat somebody with an antibiotic for maybe even a month to clear that infection. So because it's our own skin organisms that invade underneath and create a pocket underneath, we call that microbiome. And the microbiome pockets, they take a little time to resolve. So it takes a long discussion, but these are the people who've had these rolling scars. They have been on the internet, left, right, back, forth. They're usually coming in. Can I have the subcision done? They're not even thinking they can do anything else because it's all over the place that subcision is what works there, and it works well. Now, if you have reduced it to just a little bit uneven surface, Bau's thought and her approach to using something that just kind of really evens this out a little bit more can then work. And this is, for example, with the CO2 laser. Now, Bau's favorite CO2 laser is the Pixel because it's nice and superficial. It does not cause scarring because it doesn't go into the dermis, so it doesn't override this portion here, so she doesn't cause scarring with it. And unfortunately, in this scenario, you still have to decapitate normal-looking skin in order to make it even to the bound-down skin, which is scar skin, which is the principle that has been really much overhauled in the last 10 years since we have these fractionated lasers available. You know, we really don't want to grind down on the normal skin anymore to make it, to even it to the level of the scar skin. We would rather repair the scar skin and bring it up and then create a nice layered surface. But sometimes you really have no option. If somebody has atrophic scar next to atrophic scar next to atrophic scar, even in the absence of this, you still have to do something to even out the surface at some point of time. And the CO2 lasers are good for that. And whether you use the Pixel, I'm going to move over here, or you can go even a little bit stronger and wherever you are in the process and use the CO2 laser that we have here in Haverford, where I have the ability to also dial it not just into the superficial layer, but also dial it in volumes down. Then this is the general approach after this has been sort of evened out and you've made progress in your scar treatment underneath the skin.
We only get to that point. How do we get to that point, though?
How do you get a number of infinite treatments, subcision treatments here, TCA, if they still have other areas of scarring? So you think about repair first underneath, and then you think, how can this all come together and how can I give it the most polished look? But you don't start with the polished look.
Right, because then there's no point.
Because you're not doing anything fundamentally to do this. Now, had I given this talk now about 12 years ago, it would have been, the only thing that we have available is the polished look. We grind down and we make the scar to the surface and create scars next to it to make it all shiny. But we have, and this used to be abrasion, which we would do with the derm abrader, which is an instrument, and then was also done with the CO2 laser as an ablative process. We kind of just create that blank slate. It's basically scar next to scar. First is acne scar, then the scar from the CO2 laser, and then hope for the best. Right?
Do some people call that microneedling? Like there's,
Okay, this has nothing to do with microneedling.
okay.
There's no, okay, I did not mention microneedling
No,
here.
right.
I can spend a little bit of time on microneedling. So there are a number of, I have only talked about principles of permanent scar repair right now. I have not talked about any principles of how to make scars looking better without permanent repair. So if we're thinking about,
And so, but you would want to go to Infinity for your rolling scars as well first?
yes,
Okay.
you can also go for that first. You want to, if somebody says, oh, I'm not so sure that I can really have that downtime of subcision, not only that the infection is maybe, but they usually get quite some bruising because I create these pockets underneath. Like even if it's small spaces, if it bleeds into it, they have bruises. It doesn't look really great for a
How
while.
long does it usually last for the downtime? Sorry. with the
I would
subcision?
want to say
Okay.
about a week to 10 days.
Okay.
Right? I mean, some of my patients take off for a whole week. They don't go to work during that time because they're not sure how they're reacting. And every time it could be different. And they usually don't do more than two subcision appointments. Most of the time only one because I don't know that I can free up that much more. If I freed up everything already with a needle, you can free up with a laser if you want to. There's a technology with the Precision TX where you can do all of that freeing up instead of using a needle that I use. You use a laser probe underneath. And you know, that's all in the hand of the person doing it. So if I were to be a precision girl, then I would do it with the Precision FX. And that's okay also. It can be done in many different ways, subcision. It's just how you want to do it. But the key really is you have to do something to repair first. And if somebody is opposed to subcision and really wants to get going on the rolling scars, you start with the Infinity also.
Okay.
Right? Okay, so now we're talking about now non-repairing scar improvement. Okay? So scar, I'm just going to call it scar improvement but not permanent. Temporary. What are the options that we have? Well,
Excel.
On the surface.
Pixel?
Makeup.
Don't say
Wait,
that
wait,
here.
what did you say?
I
Sorry.
said
Scar improvement.
temporary scar improvement.
Ah,
Starts with P.
peels. Microderm peels.
Okay, and now we're gonna mention also microneedling. Okay, so microneedling is a technique in which you're putting tiny needles, very similar to what the pad on the Infinity looks like, into the skin and you stamp. It's a cold technique, you don't generate any heat doing that. And you kind of just prick the skin in various spaces. You can do it with a roller, you can do it with a device that stamps, it doesn't really matter. All sorts of things are allowable there. The key is if you are ever so slightly injuring here with the kind of just with that needle stick that's coming in, then maybe that collagen will be doing something. And collagen is sensitive to some sort of trauma. If you stretch collagen, if you heat collagen, with any laser that we use, we get temporary improvement in the skin texture, right? Even the PDL, even the gentle laser, and so on and so forth, because they're driving heat into this area. And so we kind of tease that collagen and it wants to do a little bit more. But unfortunately, it is temporary. The same as with every PDL and gentle laser and any of the lasers that we don't intend to do anything with. The same as with microderm, that actually through pressure into the skin will also tease that collagen that sits here, and it will temporarily look a little bit better, but unfortunately those effects, they go away. Now if somebody says, I have this wedding that I'm going to and it's in 2 months, what can you do? I mean, you're not going to take out the Infinity and try to repair their acne scars. You're going to say, let's do a little bit of this. We don't offer micro needling here, but let's do a little bit of this and we'll get you better looking, and then afterwards we're starting the repair so that going forward you have much better
To
results.
stress, this is a temporary, this isn't, right.
No lasting result. Zero lasting result. There's not even the notion that you can do anything lasting. These are truly techniques that will do almost nothing but temporary.
Okay.
They are also achieving not great results in the acne scar improvement. If somebody has really deep acne scars, I'm going to have to say, I don't know, I would say send them to a makeup artist. But if somebody has shallow acne scars and you want to improve their skin tone for just a little while, these are good techniques.
What if they have like hypertrophic scars on nose?
On where? On the nose? I don't know. What can we do for that? I think the nose is really difficult to begin with. I think the nose is not an easy area. I think it is worthwhile considering doing something with the 1540. And you know how terribly hyperpigmenting you're going to be a patient who is the darker skin type. The Infinity, if it's only, I think it can, I might even consider using it, although its forte is in atrophic scars, but maybe it could do something. Careful injections of some steroid. PDL, again not in darker skin types. YAG, not so strong maybe, it could work, but hypertrophic scars on the nose, really difficult. Atrophic scars on the nose are also really difficult. I think the nose is really difficult. Right? This is what it comes down
Do you
to.
remember this patient that was chasing us? Don't mention the name, but we had a patient that we tried to fix something on the nose.
Hi, sorry to interrupt. I have Jordan sitting in the orange chairs by your office.
Yeah, let me fight there.
Okay.
Yeah, I'm only asking because she's Vietnamese, only on the nose.
Yeah, and she's the black woman, right?
No, she's Asian. I
Right.
think there's also another
We also
another
have,
one.
yeah.
Dr.
in
Gonzalez
Sarah
patients.
right.
Yeah.
And I think this is sort of like, I'm going to have to say, I mean, you know, careful doing something here and there is maybe your answer. I don't know that I have an answer. I'm going to have to say that we don't want to do harm. We don't want to create more. We don't want to make it too obvious by creating too much hyperpigmentation. So we have to think, they have to have the means available to want to be able to go through this kind of testing. I'm not willing to do this testing for free because I have, right from the get-go, I have no treatment. I would prefer to say I have no treatment than to create the illusion that I have something. But if they
Right.
absolutely say, okay, I so trust you, I really want you to try. And, you know, obviously it's going to be a very small charge, just simply the limited laser scar treatment charge. you can work with that and do something, hopefully not to make it worse.
Test spots.
Right? And people are very sensitive about that now. So what Baruch was referring to is a patient who had a single scar on her nose. And she was so disturbed about this particular scar. And then she had many other scars everywhere else. And she had already had 4 Fraxel treatments and was undergoing like another series of what, and this scar had not improved. And so I said to her when she came, I don't know that I can improve this. I can try, but it might not work. It might really not work. And I have this all documented in my note, but she was still mad afterwards that it didn't work. And then she blamed me it got bigger. I don't know that it got bigger. It probably didn't get bigger. But it still didn't go. But you can't always treat a scar on the nose. And people need to understand that. And we can only treat somebody who agrees. And I probably will not even start the treatment until the person was in the office about 4 times or so and has totally agreed to the fact that it might not work. Okay? This is how scars go. And scars are very personal. When you do something to scars, you have to also think about the psychology of scars. And I'm sorry that I'm going over it. But the psychology of scars is enormously important. When they're coming in for you to repair the scars, they're thinking about a miracle wand that you're using on them. They're thinking you're doing something and we see nothing of the scar, not even during the repair process. They are majorly upset if you're not telling them that they're going to go through a phase where all their scars might light up again. Particularly if you're using CO2 laser, pixel, what have you. Those scars are going to now remind them of what that period of time in their life was. And it's not about acne scars only. Every other scar on their face. What if somebody was attacked by their boyfriend and they have this kind of scar and you light this up again? It brings all this psychology of that time frame back to them. It's majorly disturbing to most people, and you have to really, really very clearly communicate what you can do. And that is sometimes also what dictates what you do. Because if they cannot psychologically handle it, you're at a loss. Right? Okay, that's all I have to say about acne scars. Yes.
For acne scars that still have the depressed papules with the red,
Yeah.
are we always treating the red first?
I would prefer, but it's not absolutely kosher. PDL is good, and we submit that to insurance as long as it was ordered by a physician.
Right.
But I think it makes most sense because the information is still present. You want to avoid further progression of this potential scar. And in my opinion, if I think about it logically, this is what should be done first. I'm not willing for most of those people, unless they're under enormous time pressure, to go into something else that inflames more. What if I create a bigger scar?
Mm-hmm.
What if? I don't know what the end of that scar is. And then they're going to say, your Infinity made a bigger scar. I don't want them to say that because that's not normally the case.
Okay.
Really quickly, I'm sorry. Pico short hair. You said for the ice pick on Fitzpatrick 6. Do I pre-treat them? I know that with the Pico Genesis is fine.
So you guys.
What spot size will you use on the
Thank
short
you.
test spot?
So thank you. 6 or 8.
Are you thinking for your little friend
No,
on the
I'm
nose, or
just
just
thinking
in
in
general?
general because the Pico I use it on Fitzpatrick 6. The Genesis is totally fine, but this one is a 755, so I don't know. If we
Use,
should-
if you want to be super careful, start with a 10 to be 100% sure.
Okay.
If you're daring a little bit more, you can go to the 8. And the 6 I use on the very, very, very dark skin, but not as focus lens. So I use the regular at a 6 on Fitzpatrick 6, but I don't use the focus lens. I would probably use an 8 or 10 for the focus lens. Because the focus lens creates way more heat. It defocuses the laser, so it no longer works as a laser. It's no longer that fast. It's much slower, right? So to take that under consideration.
And then for
Dr. Rico,
Yeah,
what about fillers for scars?
excellent, but temporary solution. Let's add those 2 here. Because they kind of really see that now you've ironed out their scars, right? It's smooth. It's again the same effect as that I showed with the TCA peel. You have a smooth surface, easy to apply makeup. They love it, but it's really just not a permanent repair. The permanent filler, Bellafill, is a great option in areas where the skin will never move because it's a permanent filler. If you have somebody whose skin is going to be sagging, and then you have little kernels in the skin that are not sagging the same way, it's going to
Got
look
another
really
problem.
funny. And so that's going to be the problem when we see all of those people where the Bellafill company is now really promoting to push that filler. I'm staying away from it. I think it's okay maybe in some people in the temple area, but even that is subject to atrophy. I'm not really sure that it's a good product everywhere just because it's permanent.
The subcision scar, sorry again. Do you do that as a full area of scars, or can you also do it just for like spots?
So I look at the person, I identify the area of the rolling scars, I mark them before I even put the numbing medicine under. I do a little tumescent anesthesia under the areas of where these rolling scars are, and then I do the subcision only in those areas of those rolling scars. Most people don't have confluent rolling scars.
Okay, got it.
And are you the only one here that does subcision?
As far as I know, probably. Can every physician do it? Yes. It's just about the responsibility of creating a potential infection.
Right.
Right? You want them to shout at me, not at you.
Absolutely.
Okay.
Thank you so much.
All
That was
right.
very
Stretch
informative.
marks for
Okay, is where it drives a little deeper and repairs underneath. But play around with it. You know, everybody is going to respond a little bit differently. Stay away from the very dark skinned people because you're going to create lots of hyperpigmentation.
Is she dark skinned?
I can be our guinea pig. We tried it.
Because she's like the cusp, right?
Right?
That she just,
Right. I don't know. I'm going to be careful with bowel.
yeah.
But if you're hiding that stretch mark anyway, then it's a good area to
I can be
try.
our guinea pig.
Okay.
I am.
Good.
That's good. Thank
Okay.
you so
And for
much.
wet stretch marks, always PDN, right? You make a huge difference. And we have those fresh stretch marks.
You just
Okay.
want tone first.
Right.
Get your